इसमें या थोड़ा सा टिप डाउन करें, अब जाते रहें थोड़ा अंदर। अगर आपको या इट्स एग्जैक्टली लाइक थोड़ा सा ज़रा लंबा है, दैट्स मतलब लाइक एक्सटेंशन होती है उसके दैट्स। कौन सा तुमसे इससे तो अभी तो इससे कोई फ़र्क नहीं पड़ेगा ना, अभी तो आप समझ लो ड्यूडनोस्कोप अंदर डाल रहे हो, राइट? थोड़ा सा
Novel, can you share the case history, please? For our
no, well,
listeners?
somebody can someone tell the case history? All I know is that the patient has got an possible ampullary growth. ERCP was done, biopsies were taken which were negative. Okay.
Right, sir.
Okay. So I'll tell you something interesting. देखने में इसमें बड़ा interesting है। एक तो खालिद ने आप लोगों को बताया होगा, right? तो खालिद does this, right? He goes here and just turns around, ठीक है? And you are through, right? दूसरा तरीका ये है कि you can actually do the way you do ERCP. So you're going in, right? यहाँ पे थोड़ा सा क्योंकि ये इसका लंबा होता है, तो you need to down and little bit of movement and you will be through. ठीक है, you're through. Once you're through, then it's very smooth. ठीक है, so go ahead and do it.
Thank you.
Gentle hand is what you need, okay? But those who have intubated the side viewer, just remember that it's a little bit more. The tip is longer and more stiff. Yeah, camera. Tip is longer and more stiff, so keep that in mind and remember you're going down. But if you're stuck, then I think Khalid's way of going in with your scope facing up a little bit, bend forward, and then you just turn it around after putting it in. So now you are at what? 45, right? This is what I told you.
Yeah.
Tip up now.
Yeah, tip it
Thoda
up
sa aur
and
tip
I
up.
can see also up.
So you've got liver,
Liver, yes.
right? Now do nothing and keep your scope straight. देखो नहीं है, and start rotating.
Yeah.
Keep rotating, keep rotating, keep rotating. See, you've seen a lot of structures, right?
So we should
So keep going, keep going, keep going. We should see aorta somewhere. And if maybe we are a little bit more in because she's a lady, so come back again and just try again the same thing. We already seen kidney, right? So my slightly different way of moving is you found one landmark.
Yes.
And that's good enough for me. I don't go bother finding aorta now.
Right.
I've got kidney, I've got pancreas, body.
This is right kidney.
This is left kidney because we are in the
Left
stomach,
kidney. Okay, right.
right? So stomach say you're going to see the left kidney. So if you pull back a little, talk towards, clockwise talk. So you've got spleen, right? Wait, go back. थोड़ा सा पीछे आए.
This one I think.
आप नहीं, एक मिनट है, थोड़ा सा अंदर जाना पड़ेगा.
Okay.
थोड़ा सा अंदर जाओ, right? So when you've got the landmark, let's first come back and find the aorta just for the thing, because this is what you must have been taught. So let's come back to what? Yeah, this is good enough. So tip up करें थोड़ा अपना and start rotating.
Slowly.
So start rotating. One way of there's the aorta,
Yeah.
right? Once you've got the aorta, you start advancing. No, you don't do anything. You just keep the aorta there. अब कुछ नहीं हिलाएं. Don't move anything. Just you need to just go in a little bit. थोड़ा सा इसको release करें. हाँ, no problem. एक सेकंड दिखा मुझे. मर्जी है. You want to do this? You can come. I started early. Yeah, somebody has to be. So, okay. So the first thing we see is liver. You see my scope. I am tall, like Khalid said. Okay, so the thing that I want to find is, come back a little bit. That's the aorta, right? So now once we found the aorta, ये तुमने इसको रिवर्स तो नहीं किया हुआ इसको? You know? Yeah. So change करो.
Ulti direction.
Yeah, direction सही करो. We need to change it. The green is coming on the left. That's the problem. इसको किसने चेंज किया? बेटा इसको रिवर्स कर दिया तुम लोगों ने. एक मिनट छोड़ो उसको. वसीम को बुलाओ. मैन से इसका कोई ताल्लुक नहीं है।
इसी वजह से फील हो रहा था कि वो
हाँ वो जहाँ उल्टे ही जा रहे हैं तभी तो। यस दैट्स इट।
वो हम कुछ
Thank
कर
you.
रहे हैं, वो जा रहा है कुछ है।
ठीक है। सो नाउ इट्स
अच्छा तो
तुमने कोई और चीज़ चेंज की है? नहीं छोड़ दो।
रिवर्स आया
Yeah, ठीक। So now it's, well, we already start seeing things, so you notice there's lots of vascular structure here, right?
यस
So immediately you put this, so you've got, you know, you've got this is surely यहाँ पे varices हुए हैं already, right? So आप could come back again, we were talking about aorta, right?
Aorta, yes.
I hope have this again.
या
So lights off please,
so this is
just
the
keep
aorta.
follow now.
Yes.
ठीक है, so pull back a little bit. You just
Okay.
need to follow it slowly.
Yeah.
There's the branch coming out,
Yes.
right?
Now follow this.
Now, if you follow this, you have pancreas already. This is pancreas,
Right.
splenic vessel.
Right.
ठीक है,
Right.
आगे चलें अब आप. Now you've got pancreas, right? Pancreatic duct here. You can see that thing. Keep going a little bit. Yeah. Now if you from here, if you rotate, you see that pancreatic duct? Can you see the pancreatic duct?
This one.
This thing here.
Okay. Yes, sir.
Let me confirm that. See
Yes.
that? That's pancreatic duct.
Okay.
So what we know is pancreatic duct का जो size है, that is not
Directly.
now from here go anti-clock and see what happens. Keep going, you see your pancreatic duct is coming down. So now you can see, you just follow the pancreatic duct from here, but all you're doing is you're moving your hands, you're not doing anything else. There comes the portal vein, right?
Right.
You're right at the neck now. This is the portal vein, pancreas. If you keep going a little bit more, this is the area we should see.
Bleeding,
थोड़ा सा
right.
रुको, थोड़ा सा
Pull out. Right?
थोड़ा सा anti-clock करना है. Pancreatic duct starts going down, right? When the pancreatic duct starts going down,
Yes.
and you've seen the portal vein, you know that this is the area of the neck, right?
Right.
Now if you go clockwise, follow the duct, keep following the duct, keep the duct in the center. How do you keep the duct in the center? अगर आपने इसको अपनी तरफ लाना है, यानी लेफ्ट पे ले जाना है स्क्रीन से, तो you pull back.
Okay.
See the duct is going
Going to
away.
the left, yes.
If I go in, see there. So you need to know where the duct is going, and you keep moving your scope accordingly. I'm following the duct, following the duct, following the duct, right?
Pull out.
I'm
Yes.
following. थोड़ा सा मैंने पीछे किया,
जी, जी, जी.
right? You keep following the duct, and that's the structure that you're seeing there. I'm sure is the spleen there.
Almost the tail.
I don't know why this is not so clear. There it is. ठीक है? So you've seen the tail. Now if you go the other way, slowly, and जाते रहें, pancreatic duct को center में रखें, ठीक है? And you start going anti-clock, थोड़ा सा. You start seeing the pancreatic duct coming down there, right? And if the bile duct is dilated, we should be able to see the bile duct somewhere here. Because उसमें stent पड़ा हुआ है, तो probably नज़र आनी
ये
चाहिए.
सर ये दो white line
ये probably नीचे देख रहे हो white line दो?
जी.
That's probably the about.
Stand.
देखते हैं इसको, थोड़ा सा स्टैंड को फॉलो करते हैं.
Yes, sir. This is stand, sir.
एक मिनट ठहरो. ठीक है, तो आपने पैंक्रियास यहाँ से तो देख लिया ना. फिर so all you did was you just forward and backward movement and you can actually see the pancreas, right? हाँ,
This white line.
देख लो. सही. Now in the process you are also obviously looking at any lymph nodes. You saw these vessels. These are all obviously. ये क्या था? You start seeing bit of liver there. Lots of vessels. That's एक मिनट है ना ज़रा, वापस जाएं. This is large lymph node है. There's a mass of. ये देखो, ये what is this? So we have.
This one.
So how do you measure? You press caliper. right? And this plus sign comes. Once you've got it, you press set.
Okay.
That will give you the option to move again. You've got one length, you press set again.
Okay.
When you press set again, you get the plus sign again,
Right.
right? Then you press set again. So every time you, so now you've got the measurement.
20
One
by
पे करो.
7.
हाँ तो है लिखा हुआ 20 by 7 mm है, right? There is a little bit of central. एक मिनट का है. प्लीज तो हटाना. ठीक है, इसमें एक बीच में इसी तरह some white central वो है. So now you go in endoscopy view now. So our interest की चीज़ इसमें मुझे जो नज़र आई वो एक varices है and this mass है, whatever this. ठीक है, so keep going like you do in ERCP. तो सनसेट ऑलमोस्ट सनसेट साइन मिल जाएगा इसमें भी. तो और वैसे इफ यू कीप गोइंग यू देयर यू आर. ओके,
Then up.
yeah, no, just keep going straight like you do ERCP, exactly ERCP. But stop here, right? Stop here, slight anti-clock, tip up,
Anti-clock and
tip up. थोड़ा सा अंदर
अंदर जाना चाहिए.
बस. See, now the structure we are looking for is वो लिखे हो बेटा. EOS.
Head
The
of
structure we are looking for is the portal vein really. Head of the pancreas, yes, but अब अपने आप को rotate करें.
Okay.
रोटेट करें, देखें क्या आता है. देयर इज द स्टेंट देयर.
Yeah. It's not
ठीक है,
standing.
इट्स नॉट बट इट विल बिकम क्लियरर. सो व्हाट आई एम सेइंग इज अब आपने जगह देखी बट यू आर नॉट गेटिंग व्हाट यू वांट, सो यू नीड टू जस्ट कम बैक, टिप अप, थोड़ा सा और करें, थोड़ा सा और टिप अप करें. सो यू गॉट पैंक्रियास, दैट्स द, say what is that
This is
thing
why-
above? That's a hugely dilated CBD,
CBD, yes, sir.
right? So
Debris
we
is
measure
there.
that and you can see debris in that.
Yes.
And we measure that. That's 13 mm, 13, almost 14 mm the CBD. What is below CBD? What vessel is that?
Total vein?
That's the portal vein here. ठीक है, थोड़ा सा rotate करेंगे अब आप. So you're seeing that's the confluence, okay? Probably. This is the superior mesenteric vein, and that vessel there is probably joining there. There's lots of debris in there,
Yeah.
and you follow the CBD till the distal end. Yeah. You're almost. This is the duodenal. You can see the.
So the right is the distal.
Right is the duodenal lumen.
Okay, right.
Left is the liver.
Right, okay.
So anti-clockwise is taking you towards the liver,
4 times.
and clockwise is taking you right to the, and you can see the duodenal fallout there.
Right.
So now we need to focus on this area because
Sir, left is going us to the
liver,
in the right.
liver is on this side, duodenum में है ना, हम यहाँ हैं, ठीक है ना, right? इस जगह पे. तो जब आप अब now when you do anti-clock, you're going towards the liver. When you're doing clockwise, you're going towards the lumen. You can see the stent. Now you can see it very nicely, both the lines, right? Can you see that?
Yes.
So now what our area is this.
CBD.
I'm going to go a little bit more. Can we see a mass here? And I can't. इस एरिया में तो कम से कम मुझे नहीं लग रहा. Guys, can you see it, Khalid?
We can hear you.
Can you see as well on the?
Yeah, we can see it
Can you
well
see
on there.
lots, a very dilated CBD with lots of debris and a stent in it.
Yeah.
I'm trying to see if I can see because this lady is supposedly got a ampullary mass. They biopsied on ERCP, but that came back as nothing. But
There
I don't see anything here. Would
Yeah,
you
there is
agree?
some sort of obstruction. In
Oh,
Yeah,
the,
because it's
yeah.
compressing now.
Sorry.
America, there is some sort of obstruction.
Yeah, there is some sort of obstruction, but I can't see a mass here. So what I would do is just एक second मुझे देना.
So the direct CVD and the portal vein.
CVD, and there is a this is the pancreatic duct. So you have the stack sign where you have the pancreatic duct, CVD, and the portal vein. Yeah, but I can't see a mass all the way. You see, if you look at this one picture.
It's almost the end of the
See,
distal
Khalid, can you see this?
Like EUS images are not the best. They are
Yeah,
not
इसको
projecting the
वसीम,
best. लेकिन ये कि
I can see it clearly. You can go down literally to the mucosa. I don't see any mass there.
yeah, I can see the duodenal wall fall.
Yeah, you can
and,
see literally here. If you look at this, you can see the CVD going all the way down. I can't see anything.
Where is the PD there?
PD, you see there?
Yeah, can we follow that to the ampulla?
Yeah. And PD is not dilated, interestingly, right?
It is not.
So this is more to do with something.
Or we can take a look from D2.
I'm just wanting to go to D2 now.
Yeah.
So take the scope to D2.
Right.
So exactly the same way as you do ERCP. So image बढ़ा दो.
साथ ही वो वसीम को कहें कि कहीं से पॉइंटर का बंदोबस्त करे. There's no pointer.
Okay. Pointer. इसमें सही क्यों नहीं आ रहा? किसी ने इसको mess up किया था. Somebody had changed the rotation. Somebody had messed it up.
This is EUME2, right?
This is EUME2.
Yeah, the images are not EUME2. They are
No,
like
that's what I'm
EUME1.
saying. There's something not right. We'll sort it out. Don't worry. So आप अंदर जाओ जैसे आप करते हो उसी तरह reduce करके just come back to the ampulla.
वसीम can एक लेजर पॉइंटर का बंदोबस्त करो कहीं से.
जाओ. नहीं बेहतर नहीं है. It can be much better. अभी हमारे पास कौन सी इमेज रही है? ये वाली है ये वाली?
वहाँ पर
हम्म.
ये वाली जा रही है सेमीदार में.
आप आगे D2 में?
Compressed actually.
हाँ?
If you see this compressed area.
Compressed है. एक मिनट सिखाओ. So what we need to do is
There is some bulge there.
we'll see.
हो सकता है स्कोप की वजह से भी हो, but not-
Yeah, there's something here at the ampulla.
Looks like there is a mass.
Yes, there is something abnormal here. We're not able to go in. Wait a minute.
The violet looks like it's something. No. And that's a non जो एंट्रम में बल्ज नजर आता है ना usually like towards the nasal curvature. Most of the
You
time
see the CBD?
Yes. इसमें कहते हैं वो bulge
Portal
नजर आ
vein,
रहा था
CBD.
जब antrum में. And if you
Yeah.
put a transducer right on that,
So you can see the stent now. You can see the stent, and you can see
you can see the
and you can see the mass there.
as well.
Yeah, there is mass there. I'm going to see. I am surprised why they were not able to. So anyway, we got. We can see the stent on the
Yeah,
layer.
EUS का image बड़ा कर
EUS
दो.
बड़ा करो please.
EUS का image बड़ा करते हैं.
So you can see the CBD there with the stent there. So that gives me a. Can you see that? Yeah, that's the CBD, and you can see the stent, right? Now I'll just let go of my big wheel a little bit. So what will happen is you'll start seeing that a little bigger. That's your stent. You can also see air in it. So this is all looking.
I think it's an
This
ampullary-
area is not. This area. This
Yeah.
is clearly.
And the pancreatic duct looks okay still.
Huh?
Pancreatic duct.
Pancreatic duct is fine. That's what I'm looking at. But this area is not looking normal. just close to the cursor. This is the, you see there the stent? It's going through this mass, and so I think this is where the problem is. But I'm disappointed, how could they not get the biopsy? I'm not going to waste a needle on it.
I think if you look at the mass endoscopically, it's more like a
Can you appreciate the stent and the
yes,
the
we Yeah.
hypoechoic area here just around the stent?
yes, we can, but it is still very possible if you do a biopsy, it may be negative because it's more like an infiltrative into the wall.
I'm just thinking whether there is a,
Right there, that's where that mass, like right around the stent. It's
yeah,
not-
that's the only, I was just thinking one option was to do some FNAs from here,
Yes, that.
just there.
Thank you, bilkul.
So,
If you pull it back, scope a little bit more, and now that to rotate a little bit to the left, right that area is the one.
yeah, I am tempted to put a duodenoscope first and see.
ठीक है, I think that's very reasonable.
Give me a duodenoscope, please. Okay, so you've got a nice, big looking
Also, ये
gallbladder there,
also
right?
Again, there is some
Debris in the gallbladder, right?
look at the gallbladder like that.
Hmm? Duodenoscope la rahe ho?
जी,
Okay. So, the pictures are not good, yaar. I'm sorry, this is not right.
the pictures are not.
No, pictures are not good. I agree with you. Even here, they're not that good. You can see the pancreatic duct. The pancreas look pretty good. Khalid, can you see that?
Yeah, we can see
We're
that.
coming
but-
down towards the,
Yeah, no,
neck.
we can clearly see that going towards.
and that's the port in between.
So here,
The pancreas above, pancreas below, the duct going. Can you see that? And all I'm doing is, I don't know, Khalid, Khalid is amazing at this, but can you see I'm not doing anything here? Can just a little bit of left movement, look at that. I've got the pancreatic duct, I've got the portal vein, I've got the pancreas above, pancreatic duct coming down there, this is the neck area, and underneath that you can see the CVD, you can see the stent, G.
can you just stop there for a second? Just keep that station, please. Keep
Okay,
that.
okay.
Okay. So this is a pancreas. Everybody agrees. Pancreatic duct right there. Everybody agrees this is the portal vein, correct?
So you can see
On
the
other side
CVD,
of the portal vein.
you can see the stent, you can see the portal vein, you can see the
Remember
PD,
where, like,
you
the
can
way
see
I
the
said, like,
PD.
you're looking
You can
from
see the
top,
pancreas,
you're
you can
in
see the
deep
pancreas.
one.
This one? ये pancreatic duct है. This is actually because you're seeing it in. Khalid, is that have you explained to them? We can actually see pancreatic duct, portal vein, CBD, stent, everything in this view.
Exactly, that's what I was explaining.
ठीक है? Good. And what
This is how you see the
what
point
the
from the
what you need to understand here is that the movements that are getting me, these are very small movements just here. I'm not doing anything. If you focus on my hand, I am not doing no movement at all. This hand is free and I'm just moving this, and like Khalid said, it's because my scope, I'm a little tall, so it's easier for me. I'm a little closer. If I wanted to, if I was a little shorter, maybe I'll do the same thing standing here and achieve the same target. So this is a beautiful view of all the organs, and just below here would be the head and the uncinate. So, and you can also, when you're doing this, you know, if you use the big wheel, if you bring it close, see what happens there. You've got this, you can actually see the CBD very well from this angle, as it's very dilated, so it's not difficult. If it's not dilated, then it's not always easy to see CBD from here, especially the subject is big. Unless you're a master like Khalid, I don't bother. But this is, I think is the EUS better now than before?
Not really.
Not really. See the pancreatic duct now? जो आप पूछ रहे थे दूसरा spot क्या है, वो दूसरा spot वही pancreatic duct है. The only thing is that now we changed the thing, so you are actually seeing two parts in different areas. Is the seat, to me, I saw some air going in, so it probably is. Yeah, so obviously we need to just have a look. आ गया? So just coming back, you look at the liver. For any lesions in the liver, you can
even
see the ducts are dilated.
Ducts are dilated and you see debris and air there as
Yeah.
well.
So you can see very nicely. Khalid can point it out for you if you want. But you can see the if you're not sure, we'll put the Doppler, and when we put the Doppler, you know which one of them is duct and which not. So if I wanted to do, if I wanted to do some therapeutic stuff here and we had difficulty, then we know that we have very good access through the liver. But I haven't seen any mass in the liver so far. So you can keep going. And now we've seen this, and then we'll go the other way around. Okay, so everything is happening with just this movement, right? There's nothing happening. Looking for any lymph nodes here, but I haven't seen any. There's one thing that I saw, which I was not. What the hell? This is a lymph node that we measured already, right? So, but I don't know. This doesn't look.
It looks inflammatory.
Yeah, it looks inflammatory, but it's quite big. Yeah, it's not round, although it's pretty dark. Okay, so we come out. Yeah, it's such a big dilated duct. If you want to, you can actually follow it up from the portal vein here as well. You see, you can follow from portal vein from the liver and then go. But we are getting, and a lot of these people follow portal vein all the way to the liver. So you can do that if you want to. You know, you've got the portal vein, you're coming to the, that's the liver, that's the portal vein, and that's the portal. So you can do both portal vein and किसमें देखो इसमें इतना टेंशन लेने की ज़रूरत इसलिए कि दो ही मूवमेंट्स है ना, एक दफ़ा एंटी क्लॉक करो पता चल जाएगा, नहीं तो क्लॉक कर लो. So don't worry too much about that. So when almost 30 centimeters in ladies, around that time you start seeing this organ, right? You can see the mitral valve there, and you can see the aortic valve there, right? Although this is not what we want to do, so I'm not too bothered. Once you've seen the left atrium there, you start seeing that structure here. That's the pulmonary artery. Left atrium, that's in between is the subcarina space. You let go of your big wheel a little bit, so that open space will open up. You'll usually see a lymph node like you can see there. This is nothing, slight triangular thin lymph nodes, you will see them, they are normal. When the lymph nodes are big, you will see this whole space becoming big. Okay? Right? Now if you want to see AP window, you just need to let go, and that's your aortic arch, right? And you see that. Bring it to the end and just rotate a little bit, and you should be there, the AP window. So aorta on the right, pulmonary artery. Now it's the reverse, and you see small lymph nodes. I don't know what's the use of doing this, but and the rest of the organs are not in my book. Okay, a duodenoscope.
Yes, sir.
दो और मुझे ज़रा biopsy forceps दो यार. Okay, there is a practical learning tip here. We could use FNA, FNB here. FNA, FNB now is costing at least 100,000 rupees for a needle. And so you take a step back. My procedure will be prolonged by maybe 5 minutes, 10 minutes. If I change the scope, go down with a duodenoscope, and I'm happy to see what I'll just use a biopsy forceps, take samples and leave it. And that saves me 100,000 rupees straight. If I'm not sure, if I put the duodenoscope down and I think no, I'm not happy, then I can put the US scope again and do the same thing. It will only take 5 minutes. I don't know whether most of you sitting there would agree or not, but I think a lot of, it's very important whether you're working in the private circle or whether you're working in a setup like this, where somebody else is paying for this needle. Nothing is free in life.
So, Saad bhai, let's do a touch prep from a biopsy. I'll come and do the, either Wasim can do it and we can do
we want to do a touch prep. He's ready, we'll do it.
Yeah. So just get a biopsy from the most concerning area and then we can do the touch prep.
Yeah. वसीम, इसकी जो पिक्चर है ये हमारा है उनका वाला है? तो ये हमारी पिक्चर में क्या हुआ है? इसको थोड़ा सा बेहतर करो। somebody has touched it, somebody has touched it. किसी ने सुबह जब मैं आया हूँ ना तो this was somebody had
यार
messed
ये हमें जो है ना वो हाँ स्कोप चाहिए इमेज. थैंक यू.
When was the stand placed? We can NBI कर दो. Let's see. We'll just do NBI. NBI. No. इसमें आ गया. So this all looks pretty. I want to see if I can get in somehow. The big problem I have, Khalid, is that this is.
You're an NBI.
Take off the NBI now. The big problem I have now is that you're not able to get into this thing.
I think it's becoming more infiltrated since
It's
the
become.
RCT.
Yeah, so now. When was the last ERCP done, beta? No. Sorry, कब हुआ था? I'm going to focus and target this. Anywhere between this area. And also the field.
I think I'll biopsy close to the stand where it's coming
That's why I'm
out.
trying to get in. Right, best. Oh, there it is. Okay, open. Close. Open. Yes. So. He's only 50 something, yeah.
वो वसीम स्लाइड्स बना रहा.
वसीम टच स्लाइड बना दी. सैंपल उसको देना आप. तुम उसको क्यों नहीं दिया? वसीम सैंपल लो. ओपन. ये ले जाओ.
वहीं ला रहा हूँ.
Interestingly, she's not complaining of obstructive symptoms, right? This area really looks interesting. Open.
Yes.
Close. No, open. Close.
Looking like this.
हाँ. Patient has no fever, and what are the LFTs like now? Fever, LFTs, can I find, बता सकते हो please? हाँ. तो थोड़ा सा मुझे और एक फॉलोइंग बैक. छोटा वाला स्कोप चला जाएगा, आई एम श्योर. नहीं नहीं अभी नहीं. बता करके बताओ मुझे पेशेंट की कंडीशन का.
डॉक्टर को बुलाएं.
I'm thinking of whether, yeah, I'm thinking here two problems. One, the patient is not complaining of obstruction for now, so we are okay, but I want to know what the LFTs are and if the patient's got any signs of blocked stent, because there's lots of debris and the duct is still very dilated. So we need to think about changing that stent. With this obstruction the way it is, and I'm sure it wasn't like this before, so it's obviously pretty aggressive and fast. So what treatment options do we have is a big question, right? And थोड़ा सा इनको लेफ्ट लैटरल पे करना और. Thank you. I think the option would be in the R setting. I mean, obviously, whether you go for surgical in a 50-year-old person, Assalamu alaikum, in a 50-some-year-old person. When was the CT scan done? जरा कौन है यहाँ पे बेटा?
बेटा पेशेंट को फाइल दे दो. किसके पास?
Abir, any fellow here? Nasir, Abir, Asim, Nawal, anybody? There should be one person here all the time. I need to know which were the patient's pyrexial or not, patient's LFTs, where are they? And there should be somebody here. So you can't have it all on yourself. Pass it on to Nasir, pass it on to Abir. Everybody should have one case and they should know everything about it. Fever and LFTs. And when was the CT scan done? Why did they do an MRCP? Idiot. Okay.
When she had her ERCP done in Dow, after that her LFTs had settled down. The repeat ones right now are showing that they're elevated again.
Again.
So it might be that since we called her back, her LFTs have drained in this window.
She hasn't got any fever.
So she hasn't gotten any.
And she's not vomiting.
No.
And she's not had CT scan in the last 1 month.
She's had a CT scan. She's only had an MRI visit. That was on the first one.
She needs a CT scan.
संजीव भाई हो गया आपका काम? बस सही है
डन?
3 नहीं है हमने
नहीं 3 से ज़्यादा ले ली।
तो वहाँ दे दिए
नहीं वो तो वापस आ जाएंगी, वो तो टच में रहते। ओपन। क्लोज। So what's the
I got all of her information. Can I just tell you one though? So she's 50 years old. She had epigastric pain. She went to Dow. Over there, she was evaluated with an endoscopy,
What she's saying is
which was normal. She had an ultrasound that showed dilated intrahepatic duct, and she had deranged LFT. They did an ERCP in Dow and replaced the stent. And in the ERCP, they found that there was some narrowing. So they went for a CT scan then. That had intrahepatic ductal dilatation, and there was also a cutoff at the distal end of the CBD, which the report also mentioned was likely to be the stricture, but there were no lymph nodes. After that,
Open.
the patient had persistent pain. Ultrasound showed a collection. MRCP showed biloma. So the biloma, we had it checked in SIAG by ultrasound. They said there was no collection. So the LFTs were also settling by then. So we decided to keep an EUF, and now the LFTs are jumping up. So we'll probably do a stent exchange tomorrow.
this extent exchange won't be possible. You have to try doing a small stent, small stroke. कितने हो गए?
5 to 7
So I usually take 8 to 10 samples in someone like this. I don't want to leave any excuses for. जरा मुझे थोड़ा सा वॉश देना पड़ेगा as well. चलो. Open.
yes
Slow.
close
मेरे लग भी करना चाहिए. टोटल कितने हो गए सैंपल? 8 हो गए.
8 हो गए
So what options do we have here? I mean, this patient has is only 50, and she's got both duodenal and biliary obstruction. She's got a stent which is working, if at all partially, with a pretty significant dilated duct with debris in it. No fever at the moment. Khalid, can you hear me?
Yeah, we can hear you.
So, management options.
जी इसका management option, it's obstructive jaundice, there is an infiltrative process. If he's a good surgical candidate, even if you don't have a positive biopsy, I think he needs a surgical resection.
Absolutely, because
yes.
it's made easy by the fact that she's obstructed now.
Yeah.
So she's got both duodenal and biliary obstruction. For us, for this part of the world, surgery would come out to be more effective and actually maybe a cheaper option.
No, it's for any part of the world. If
Okay, so this
patient
is
a
a
good
better
surgi-
option. So this is what we'll go for.
No, even if biopsy they are not happy with that.
Absolutely, Khalid. I
then
agree with
patient
you.
needs to go for surgery if she's a good surgical
Agree.
candidate.
Huh? Well, they will go in and obviously put a laparoscope and see what they want to do. If they open up and they find out that there's a disease elsewhere, then they can just do bypasses and come out. And if it's something they can take completely off, then
Yeah, if they gotta do bypass, they can do a both biliary and intestinal bypass.
you can't because I think it's beyond the ampulectomy thing because it's actually it's involving uterine causing obstruction. So
Touch prep.
now you are basically talking about either complete.
FNA आप जब लेते हैं FNB, तो you taking a deeper specimen, so there is a stroma on that, ठीक है? तो histopathologists they are more comfortable interpreting that. If you just do a touch prep, like in this case, even though there is some pleomorphism, if you look at this cell, it's bigger than many of the other cells, ठीक है? But I don't see much of the chromatin in there, like a lot of chromatin dots in there. So this one, because it's touch prep, there's no stroma, they may not be very comfortable. They may just call it atypia related to inflammatory process related to the stent. So on touch prep,
Khalid?
जी
खालिद आपको आवाज़ आ रही है?
जी आ रही है.
खालिद आपको ये नज़र आ रहा है ये cells?
हाँ जी, मैं वही explain कर रहा था.
अच्छा, very good. So we can do that right in that room. I think you've got the same view, right?
जी,
So I'm coming there, and so we can actually see this. Okay.
Okay.
Or you want me to be here to move? Is this a big? Is this? I think this is a nice place for.
Yeah, I think this is fine. Wasim
ठीक
or
है.
somebody else can
Okay,
move
चलो.
it, and we can. Okay, I will just wait for a couple of minutes before you get here.